Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for joining us for today's webinar, using interoperability to supercharge home health operations. My name is Molly Casey, and I'm on the marketing team at Axxess. Axxess is a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Joining us today are Andrew Borg-Schulte and Tim Ingram. Andrew is the product marketing manager for the Informed Care Decisions portfolio at SureScripts. In this role, he is charged with driving growth and demand for the solutions, in addition to messaging, sales enablement, and project management. He brings a unique understanding of the industry stakeholders through his experience with PBMs, health plans, physicians, EHR partners, and health systems. Before joining SureScripts, Andrew spent nearly a decade in marketing roles at healthcare organizations, including Elsevier and Dr. First. Tim Ingram serves as the Senior Vice President of Business Development at Axxess. Tim is responsible for leading the business development team to build valuable industry partnerships and key product integrations that create solutions for Axxess clients. Prior to joining Axxess in February 2018, Tim served as the Regional Administrator for Encompass Home Health and Vice President of Sales for Home Care Homebase, among other industry positions. Before we begin, a few quick housekeeping items. Your phones have been muted, but we encourage you to submit questions through the question feature within the webinar. You will also see there is a handout section where you can download the slides for this webinar, in addition to an overview of clinical direct messaging, which the team will talk a bit about shortly. We will answer as many questions as we can toward the end of the webinar. And a quick reminder that slides from today's presentation, along with the recording, will be emailed to all who registered via email. Andrew and Tim, over to you.
Hello, Molly, and thank you. Thank you also again, everyone, for joining us this afternoon. And I'm looking forward to this conversation with Andrew and learning more about SureScripts and how to, as the title says, supercharge home health operations using interoperability. And on our agenda, what we have for the call today is initially, we're going to talk about SureScripts' role in healthcare. Then we will review what exactly is clinical direct messaging. We'll talk about how clinical direct messaging works. And then what are some common use cases for clinical direct messaging? What are the key advantages? And then we'll finish up with how does the SureScripts integration come to life within the Axxess Home Health solution. And I believe what we are going to do before I turn it over to Andrew is our first audience poll question. And so on the next slide, you will see a poll question about interoperability. And so I will read this question out, and then we'll give you a little time to answer. And then I'll turn it back over, or excuse me, I'll turn it over for Andrew to walk through the presentation. So the question is your organization currently using interoperability to connect your electronic medical record system with other providers? And then you see the 4 answers below that: yes, no, not applicable, or I'm not sure. And you can click one of those, and we will provide the results of this poll later on during the discussion. And so, Andrew, I am happy now to turn it over to you and help educate us.
Great, thanks. I will just give that poll a few seconds to close up.
Okay.
All right. Okay, so first things first, I'm Andrew, as previously mentioned. You guys got the full bio and all that, so I won't bore you with any of that, but I'm super excited to be here today and appreciative of your time. We know that's not easy to find time, and so we're going to make this, fairly straightforward and engaging, and talk about some real life things, as well as some of the value and benefits of this particular solution, and also us here at SureScripts and our work with Axxess and others going forward. especially in this segment of the market. We are extremely excited to be a part of this group. So I will skip through the agenda here and actually just talk a little bit about our role in healthcare. For those of you who may not be familiar, we cut across a wide berth here of all of the different stakeholders, and you see there on the left, right, which is really true, and we truly focus on this as sort of our North Star, or our guiding principles as we work on different projects and solutions and with different partners, which is to serve the nation with the single most trusted and capable health information network. And that's, again, built to increase patient safety, lower costs, and ensure quality care. And that visual in the center, I think, is really important too, to help understand kind of where we sit and what we call this meshed together thing that you see in the middle is the SureScripts Network Alliance. And that includes Axxess, and that includes PBMs, hospitals, health systems, pharmacies, all of the different stakeholders within the healthcare industry, because to the point here to be made, to the name of this presentation, or in the name of this presentation, you can't really have true interoperability if we don't have all of those different stakeholders involved, right? If we weren't connected to a bunch of pharmacies, for example, then you're missing a big part of what we would consider interoperability. And so I think that's really important to keep in mind as well when we talk about this solution in particular, because again, this is one that also cuts across the different segments as far as where some of the data is coming from and who's connected to who. So just to show a little bit about some of the scope, 314 million patients is approximately what we cover. That's I believe right around 95% of those eligible patients. Almost 2 million healthcare professionals and organizations that are connected. Last year we did over 19 billion transactions. Almost 2 billion of those were e-prescriptions. And on top of all that, what we're really focused on and continue to focus on is our quality, right? So an 80% improvement in the quality index score for electronic prescriptions. And that means that, the fields and things are accurate, that it's meeting the correct standards, right? Because it's not just about data and number of data and quantity of data. It's obviously about the accuracy and the trust and the reliability of that data. And that is critically important to us at SureScripts and to all folks and truthfully all folks in the health IT world and those who use those solutions like yourselves. So just to give you an idea where this product that we're going to talk about today, Clinical Direct Messaging, where it sort of sits within our ecosystem, quote unquote. So as previously mentioned, I'm the product manager for our Informed Care Decisions portfolio. As you can see, that's half of our products, right? And that falls under that, along with some of our other solutions, medication history, clinical history, of course, e-prescribing, and then things like prior authorization and benefit optimization, right? So eligibility and formulary and those different things. Just gives you an idea, again, of the depth and breadth of our solutions here at SureScripts. And so just wanted to set the table with that a little bit for those who may not be familiar with the work that we do in the industry and where some of our focus areas lie. Okay, and I believe we have another poll here, which is what is the most challenging aspect of managing transitions of care? And I won't read off these answers since you guys, I know, have them up on your screen. So I'll give the folks a little time to answer. And as Tim mentioned, we will circle back with the results of those, and if we have time to discuss a little further as well, because I think that's really important to see where the folks on this call kind of fit into some of these questions as far as where you might uncover some challenges. Okay. So I wanted to, now we're going to really get into the meat of the presentation, if you will, about this particular solution, again, clinical direct messaging. And so to get to that, I want to get to some stuff that's not so much fun, right? Some of the challenges and some of the things that we have seen, heard, researched, etc. And that is, in some cases, right? So for many home health organizations, sending those updates to providers or payers or pharmacies about care coordination can have several issues. So number one, forced to use outdated technology such as fax or mail. I'm sure we've all experienced this. I know I have I've experienced this as a patient, of course, seeing faxes and things come through at doctors' offices, or them not being able to pull my records from another visit from a different physician or a different health system or a different EHR or whatever it might be, right? And I think as we all can identify that being a somewhat stressful experience or frustrating experience for the patient. And I imagine it's almost as frustrating, if not more frustrating, from the provider, nurse, whomever side of things as well, right? In the course of doing your job, is being forced to rely on some outdated technology. And that's where we're moving things forward with supercharging this interoperability and these operations, right? How can we streamline and improve the workflow so that the folks who are charged with taking care of patients can spend more time taking care of patients, right? That's critically important and something I think about every day as I do my work here at SureScripts, and I know all of my colleagues do as well. And then on top of that, right, is the potential inability to verify the appropriate providers or organizations, right? Did that provider's office move? Did he or she retire? Is this a different Dr. Smith? Do I have to Google and figure out or confirm or call or follow up, right? So it's not a fun experience to spend time doing that, right? And on top of that, let's say we're able to verify, we're maybe still forced to use some outdated technology or wait on the phone or have to wait for a callback or a voicemail or whatever the case might be, which is taking that person out of their workflow and out of their, again, sort of core competency, right, of treating patients, is then I have to do the sort of time-consuming manual processes on top of that, which is if I get the fax, now I've got a paper fax that isn't, of course, compatible or built in to my electronic health system. And that's not very helpful either, right? So there's all of these roadblocks right now to preventing interoperability, right? Think about of course, the obvious analogy of driving on a highway, right? You've got maybe the exit's closed, or now it's down to one lane because of construction, and then it goes, you get rerouted, so you're driving around longer, right? So what we are doing, or what we're doing and trying to do here as a company, along with Axxess, obviously, is to remove those roadblocks, to have a clear road, to have roads that are clearly marked so you know that you're going in the right direction, to further extend this analogy. Now, I'll try to avoid making that the entirety of this presentation is one long car analogy, but as someone who's staring out the window at my car in the driveway, it was an obvious choice. Okay, so just to kind of prove this point a little further, is that, poor care coordination is costly, right? In fact, fragmented care raises chronic disease costs by over $4,500 per patient. And that's likely on the low end. And what that includes, of course, is all the things we're talking about, right? From the inefficiencies and wasted time and those costs associated with that, to even things such as duplicate testing or even duplicate therapies because care coordination wasn't correct, right? 2 MRIs that didn't need to be done back to back, or 2 procedures one that had already been done or that didn't need to be completed in that particular order, especially if it's something that there's a risk to the patient as well, right? So not only cost, but avoiding a risk of unnecessary procedures because of poor care coordination is a big, big concern. So now the fun part, right? Now this is where we flip and say, what if? Which is, what if you could securely receive critical patient information directly from verified providers and organizations without leaving the Axxess workflow, right? That's the big question. And we're here to tell you that, of course, you can, right? That's what this solution provides, is the ability to do that. And that's what we're going to dig into now. So what is it, right? What is clinical direct messaging? It's a simple, secure, scalable, and standards-based way for healthcare organizations to send and receive health information across all care settings. And that includes more healthcare professionals than any other service, right? So our directories that are associated with that give you that verified access to those providers so that, again, you know that Dr. Smith is the right Dr. Smith in Arkansas and not a Dr. Smith in Connecticut or whatever. And you know that it's a current address, direct address in this case is what they're called. And I'll touch on some of that a little bit because it's verified by a third-party organization. So we are a HISP for Direct Trust, who is the standards organization in charge of the direct message and sort of the capital D, if you will, a direct message, which means that it is HIPAA secure, it's, again, verified, all of these things, right? So we conform to that standard and are a full service provider with them because that then provides that level of interoperability, right? Because if you don't get on the same standards, then you, again, can't really have true interoperability, right? It'd be sort of like trying to talk to someone in a different language. It just doesn't work. So I want to just highlight again a few of the top level benefits and a few of the things that we talk about when we talk about clinical direct messaging. So better informed care. And what I mean by that is our smart capability, our smart messaging capability allows clinicians and others to efficiently sort and handle time-sensitive communications. And that can, of course, include things like referrals, admissions, lab tests, and more, right? So just like in your email inbox, right, certain things can get lost if you don't have any kind of filters or if there's not a way to float the priority items to the top. And that's what our smart messaging allows, is to not let things that are truly important get lost. Again, I mentioned our massive network, right? And that's seamless direct communication with almost 650,000 healthcare professionals. And again, that reach is very important. And that the coordination and updating of those directories to ensure their accuracy, and by the way, to continue to grow them, right? For example, as we have added Axxess and you folks into our network, right? We grow that network, which is beneficial to not only you, but then to the folks on the other side, right? To health systems that are working with Axxess clients and have patients that they're doing care coordination with, pharmacies, all the interconnected players also benefit from more healthcare professionals being added, right? So again, that's a really big win for all of us. And it's something that why it's important to show, especially at the beginning, why I think it's important for us to show the size of our network, because that size has an impact on the ability to do these kind of interoperable things, right? Of course, if there was, this is a great service, but if you guys could only connect to 4 other physicians in the area, that wouldn't really do anyone a ton of good, right? So the size is really an important factor to ensure that you have the reach needed to help coordinate care with patients from across the country or wherever they may have sought care. And that's another thing I think that's important too, right? Is patients are more, well, unfortunately not over the last year or so, but patients are more mobile than ever, right? They might be snowbirds, they might take several vacations, visit family and things like that. And along the way, they may have care events, unfortunately, right? They may have to stop at an urgent care somewhere. They may need treatment while traveling, or and those things in a less sophisticated system, or a system that isn't interconnected and across the entire country, like the SureScripts network alliances, those out of town type of visits may have gotten lost previously, right? It may not be something that the provider is even aware of in some cases. So that's really crucial. We don't just talk about the network to brag. It's because of the importance of it to again, that goal of true interoperability. Secure and reliable. And again, this is as important as anything we're going to talk about today, is the confidence in the security and reliability of this solution. We're one of only 105 companies, US companies, certified for the highest level of information security. And that's not just healthcare, by the way. That is just companies, period. And we guarantee those messages are delivered every time, right? So that's the other important thing. Secure and reliable. Secure, of course, from a HIPAA perspective, right? We are committed and dedicated to respecting patients' privacy and their protected health information, and ensuring that all of our organizations that we work with also follow that same code, if you will, law, because truthfully it is. And in addition, it just provides the confidence from the provider as well as the patient that this information is going to exactly who we say it's going to, and no one else. And then on top of that, really, is maximize revenue. And that might seem a little out of place here, but I think it's really important to talk about, right? Is because it can help you to avoid regulatory penalties and maximize those reimbursements, right? We talked about the care coordination and all the different initiatives, right? And all the things through healthcare at large that we know organizations are either incented to do or to not do, right? Through CMS, through Medicare, Medicaid, all those different things that are crucial to the revenue that comes in to pay for those services, right? And so improving the care coordination, having this more interoperable environment is only going to benefit those efforts as well. And then you sort of get the triple aim as well, and the, again, to use a cliche, the win-win of better patient outcomes and improved reimbursements, avoiding any regulatory issues, and being able to dedicate, your time and organization to the successful, affordable, and reliable care of your patients, and not being worried about the technology. Our goal, especially for this solution, is that if you don't notice it, that's a win, because that means it's working, and that means it's doing its job. It's built into the workflow. It's a seamless process, and it's not something that you even think about once you're up and running with it and have sort of learned how it works. Is that it's simply just like your email or any of these other things that we've come to rely on, text messaging or any other kind of messaging, is that it just simply works, right? So that, again, you can focus on your day-to-day. So just a quick overview of how it works, if you will. This is obviously extremely simplified, but again, it kind of shows where SureScripts sits in the middle there. So we have the end user organization, that would be you guys, right? One of your home health organizations, and the feeds into SureScripts, and you could think of us as kind of that central hub, right? And we then have these connections to all these different groups, the acute EHRs, ambulatory EHRs, HIEs, and then of course Direct Trust, who is, as I mentioned, that standards organization, and it sort of all coalesces in the center there, under that SureScript sort of orange, representing again the alliance. And so the benefit, of course, the most obvious benefit there that I think that this visualization helps to show is that you don't have to, of course, go and connect to all these hundreds of thousands of other organizations. You just connect to SureScripts. And in this case, Axxess is connecting to SureScripts. And so we're helping you all connect into that same network. And so it's like, you know, you flip the switch and now you have access to all of these other locations and organizations and the data that they can provide to help you treat your patients. So let's talk a little bit about what it looks like in action, right? This is a fairly straightforward example, but I think it's important to bring it to the real world here, right? We've been talking sort of high level and benefits, and here's some illustrations and things, but this is a real life example that I think helps to really crystallize what the benefits of this solution are. So first things first, we have a discharge event. So Roland is discharged after the hospital. Hospital provider prepares and verifies his discharge summary and then the home health referral, right? Pretty standard so far. Using CDM, the hospital provider securely sends this info to both Roland's primary care physician and the home health organization that will be providing care, right? So now this data that's coming from the hospital is being sent to multiple places, to multiple stakeholders, right? In this case, the primary care physician and also the home health organization, who need that information, right? And who want that information for a million reasons, for, you know, records, for ensuring, again, what actually happened in the visit itself, right? And what are the follow-up actions, and what are the, you know, are there any meds that need to be ordered or discontinued, or were there, you know, reactions that we need to worry about, or what procedures exactly were done, and is there follow-up for that? All of those things, right? But most importantly, it can be very simply added to the patient chart, because again, it's in workflow. It's not a stack of faxes. It's not something that gets mailed or dropped off, or that the patient has to bring with them in some huge folder that gets lost in the shuffle, right? This is electronically delivered securely to the appropriate caregivers, and now have that clear and complete view of what actually happened at the hospital, which I know is extremely important in all examples, but especially when someone's leaving a hospital, right? Because of course, the last thing we want is for a lack of information or a lack of care coordination to cause a readmission, or to cause an adverse drug event, or any kind of negative outcome, right? Those kind of things, you know, can happen, unfortunately, even when everything is done perfectly, but we don't want the information that is crucial, the actionable intelligence, as we like to call it here at TrueScripts. We don't want that to be an impediment, a roadblock. Again, we're removing those roadblocks that are potentially getting in the way of the optimal patient journey, right? And this, of course, you know, in an ideal world, again, leads to confidence in those clinical decisions, right? So the information appears as a message in the Axxess home health alert center. And so then Roland's clinician can confidently prescribe a change in medication, let's say, that's the outcome based on the information that was received in the discharge, that actually, you know what, we do need to make a change in the medication for whatever reason. I'm not going to go too far down that road in a hypothetical. I am not a clinician, and I do not pretend to be, but it is crucial, of course, to have that intelligence before making any kind of clinical decision. And in this case, in this example, it's having that discharge information from the hospital staff. So I want to talk next here about some common use case discussion, as far as what are some things that that you can actually receive, right? You know, I've talked about you know, clinical documents or documentation or messages, and you know, in sort of a generic way, but let's talk a little bit about some of these specifics, right? So if you think about, so right now, as you can see, we have the today and we have the future. So as of right now, the Axxess customers can receive the following, right? Which are referrals, care plan orders, discharge summaries, last note visit summaries, and actually, I'm just going to take a quick. Excuse me, sorry, all the forced heat with the winter weather. I need to grab a quick drink of water. Last visit note summaries, lab results, and medical records. And of course, these can come from places like doctor's appointments, inpatient discharge, or emergency discharge. And they can also be related to start of care or simply routine visits. And as you can see on the right-hand side, again, it's grayed out, but in the future, you guys will also be able to share those things out to the appropriate or necessary stakeholders or organizations, right? So just going to help, again, another piece that helps to make it real here and shows some of the real examples of the types of documents that organizations like yourselves are sending with clinical direct messaging and the benefit that they're getting out of those by having that data, being able to receive that data and having it again in their workflow. So a couple other stats here that I think help to lay out some of the issues. For example, 1 in 10 emergency department patients had been seen at a different hospital within the past 12 months alone. And the reason I included this stat is it shows what I had mentioned, right, which is the mobility of patients. And mobility, by the way, does not just mean that they traveled out of state. It could just mean simply that they went and sought care somewhere else. They might not need depending on their insurance or depending on their preference, they may not need a referral or want the referral. If I wanted to go get my knee checked out for something, especially now, I can get online, get on ZocDoc, or call around and have an appointment within a week. And my primary care physician may not be aware of that, right? If I don't let them know. So that speaks to that kind of hypermobility, even within a local context, and why it would be crucial to have knowledge of those kind of events, care events. And as we mentioned about being forced to use old or outdated technology, you can see only 30% of physicians report having a secure electronic way to communicate with their patients' other care providers. Only 30%. So that's obviously a number that we are committed to improving and have improved over the past several years. And sort of along with that, half of physicians surveyed say that data access could be much better, right? And that really speaks to just interoperability on the whole. And again, our focus on interoperability, especially in this area of home health and long-term care, and we have seen huge improvements in this area and continue to see with support and commitment from our great partners like Axxess. And then the last one, I saved this one for last because it's the one that kind of upsets me the most, which is that only 12 to 34% of hospital discharge summaries reach those outpatient care teams in time for the appointments. So the documents got created, right? They were packaged up in some way, whether it was fax or electronic or some version, but less than half, not even close to half of the time do they even get to the correct provider in time for them to use that information. So it was all for naught, right? And that's what we're trying to avoid. And what we will avoid with solutions like clinical direct messaging, because again, they can electronically send those out to multiple parties and it's there in minutes, not days or hours, right? So just wanted to, this is kind of the closing benefit slide here again, just to hit some of the high points that we've talked about. Improves patient outcomes, streamlines operations, and decreases costs. Right? Those are the, 3 walk-away things. If I had 20 seconds to tell someone about clinical direct messaging, those would be the 3 things that I would hit. And so I think it's really important to kind of use those as our takeaway. So last but not least, there was some interesting work here done by, speaking of our friends at Direct Trust, they put together some good stats specifically around faxing. They had a campaign last year around, killing the fax or axe the fax or all those different things. In fact, we did some interesting things in this area as well. We have an article that's actually out on Home Healthcare News about our interesting little art project we did, which is that we hired an artist to take apart, break down old fax machines and turn them into interesting little creations, little gadgets or things that you might use around the house. And again, just as an interesting way to say, look, hopefully these things, we don't need these fax machines anymore as we continue to improve interoperability. So let's do something fun with them. But the core of that, right, of course, is how do we move away from faxes? Because we know that they aren't, by any stretch of the imagination, the best way to communicate some of this information. In fact, but unfortunately, 75% of patient information is still exchanged via fax. And that's around 9 billion pages continue to be exchanged. 125 billion is just the annual fax cost, right? So again, this also isn't free. When you think about paper and toner and all those things that have to be refilled every, day, week, month, 30% of tests that are reordered are due to lost faxes. So that's the other thing, right? They're also not that effective. Things can fall off the tray. Someone picks up the wrong thing. It gets moved into a different pile. All of the issues that are completely avoided with an electronic solution. And the other part is there's some very serious monetary penalties when it comes to HIPAA violations for faxing the wrong number, exposing PHI, et cetera. And again, another stat there, around 80% of all serious medical mistakes are poor communication, which, as we mentioned, can happen much easier with faxes because of the decreased reliability. And I'm not going to read through all of these comparisons here, but just want to highlight a couple, right? If you think a modern exchange with direct, and you can see kind of the side-by-side here, the security is a huge issue, as we've talked about, right? Fax machine hacks, or just simply the fact that paper standing on a tray is not secure. I mean, we've all been to providers' offices, right? Someone, could, be going down to the bathroom or something and see. I mean, you can very easily see where the fax room is, and I mean that's not secure, right? You have private information that's essentially sitting out on a tray around other patients or around, folks who may be in there cleaning or whatever the reason might be. It's obviously not a secure solution. It's also not reliable, right? Busy signals, lost, resends. I'm sure we've all had to do that for different things where I think I had to actually fax something not too recently for something with my mortgage. And I was like, first of all, really, we have to fax? But they had to send it 2 or 3 times because it just didn't go through. It wasn't the wrong number. It's just, they aren't super reliable. And inefficient, right? Again, we talked about that. And in fact, there's some, as you can see there's some data they've uncovered that it can save up to 70% in labor by electronically reconciling and filing PHI, EHI, et cetera, directly into the patient chart. And again, that word direct, I think, speaks to all of these different things. And that's why that is what the standard is called, that it's a capital D direct message, if you will. That denotes all of these things that we're talking about today. And that's part of why we have partnered so closely with Direct Trust, because again, we then rely on that third-party standards organization to ensure the security, reliability of those messages and of the directories, right? Which again is the really important part, that it's going to the right folks. So with that, we are at a good stopping point here. So I'm going to turn it over to questions, and then after that, we'll give it some time for any questions to come through the chat or the question feature, and then I will turn it back to Tim to walk through some of the screenshots and how it actually sort of comes to life within your Axxess interface.
Okay, Andrew, I have a couple of questions in the chat, which I'll ask you now. The first is, and I think you answered this, but maybe you could reiterate, why would someone opt to receive clinical direct messages instead of faxes, phone calls, or emails?
Right. Yeah, it's basically the many of the different things we've mentioned, right? But the ability for it to go in workflow, It's also, for example, versus a phone call, it's what we like to call, or what we would often call asynchronous communication, meaning, you don't have to be sitting there waiting on hold, right? A request can, they can be sending something and you can be doing other work in the meantime. It's more secure. And again, it's also a huge savings on the labor, the manual labor of taking a printed fax paper and then having to type all that info into a patient chart, for example, or having to scan it and it doesn't quite scan right and it's not in the right format. It's not structured data either, which is critically important, especially as the way that EHRs ingest that discrete data, right, is also super important. It can parse out those different data elements and put them where they need to go. So for all those reasons, that's really the main advantages.
Great. Next question. Does Clinical Direct Messaging interface or integrate with Allscripts and Epic? To clarify, our agency communicates to outside facilities who are either on Allscripts or Epic.
Yes, it does. So in that example, just to highlight that, or just to make it real simple here, I'll go back. Oh, wait a minute. There we go. So in that example, the ambulatory EHR, right? Let's say that would be your Allscripts and acute is your Epic. So in this scenario, that just to bring those to this, that's exactly what that would be.
Perfect. How would a home health organization create or get assigned their own direct address and know which agencies within their network have direct addresses already?
Yes. Brian, I'm going to just turn that over to you if you don't mind. I'll let Brian introduce himself and just talk through at a high level that process. And that may also be something that, Tim, you might want to speak to as well, depending on how you guys are handling that from a technical standpoint.
Yeah, thanks, Andrew. Hi, everyone. This is Brian Nelson. I'm a solutions engineer here with SureScripts. So kind of on the line for some more in-depth questions regarding these types of items. So typically when end user organizations such as yourselves would be onboarded for clinical direct messaging, and again, Tim, you might want to walk through this a little bit more specifically as it relates to Axxess Technologies, but our health technology partners such as Axxess Technologies would work with you to provision out a direct address. So you can think of this as kind of a secure email address, if you will, to kind of put it into layman's terms. So we would basically authorize and approve and validate that direct address as associated to your organization. And I do want to specify that it can be at an organizational level or an agency level, as well as an individual provider level. So then we can propagate that in our clinical direct messaging directory that we publish out to that 648,000 different healthcare professionals, so that when you are accessing and trying to look up an organization or a primary care provider to send a clinical continuity of care document out to, you would have access to all those provider and organizational level records that would indicate who has access to direct secure messaging, who's available to receive, and then vice versa. When your organizations, your referring organizations, so in the example earlier with Epic and Allscripts, they would be able to identify your agency or your organization and direct that referral message or a discharge summary by leveraging the SureScripts directory of provider and organizational records. So hopefully that answered the question.
Okay, one more question related, I think. Then how might we notify other healthcare providers that we're ready to receive referrals, et cetera, using clinical direct messaging?
Yep. I was gonna say, Brian, if you or Tim, if you guys have a thought on that, because I don't know typically. I believe that's sort of organization by organization.
Yeah, so this is Brian again, and I know working with some of our other home care agencies as well as long-term post-acute care facilities, when we've worked with them in years past to roll out clinical direct messaging, typically there's an identifiable list, short list, if you will, of organizations that do the vast majority of your referrals or exchanges of clinical information. And by working with those organizations to proactively identify them and get in contact with them to inform them of the availability to receive this electronically, has been incredibly beneficial during kind of that deployment phase or rollout, if you will, but then also making sure to have published direct addresses in the directory that's available and updated on a daily basis to all of our other network constituents has been the most effective manner in kind of spreading that word, if you will, of your ability to receive and send clinical direct messages.
Great. Do we have any other questions?
That's it for right now.
Okay. Well, in that case, I will turn it over to Tim and get us to the next little ending section here as we wrap up.
Yes. Okay. Thank you so much, Andrew. And Brian, thanks for your technical help as well. I'm sure we'll have some additional questions, if not on this call, as we begin to roll this out to Axxess specific clients. And so what we want to do now is walk through how clinical direct messaging comes to life within the Axxess Home Health solution. And the first thing you are going to need to do, and so for those on the call who are already using Axxess or soon will be using Axxess, this is what you're going to be seeing if you choose to activate the interface with SureScripts that we have built out now. The first thing you're going to need to do is go into the users that you would like to give access to this clinical direct messaging. And there, if you look on the screen over to the right, the box that is highlighted in red, Manage Alert Center / Manage SureScripts Alerts, that will need to be checked on an individual basis. And so as a quick reminder, you'll need to go into your user profile and then select the permissions on the left, and that's where you'll be able to check this box. Once you have checked this box, what you'll see on the next slide is then what you'll be able to make come to life, if you will. And so on this one, after you have activated those permissions within a user's profile, from the main screen, you can go to the home button, and when you hover over that home button, you'll see in the drop-down menu there at the bottom, once you have activated permissions, when you are logged in as a user that has the permission to see the Alert Center, you will see that Alert Center. And that's a new functionality, a new feature that we have added for our SureScripts interface to work effectively. And we have a lot of plans in the future to build out this Alert Center for some other things. But for now, just remember, this is where you will go to access those clinical direct messages that Andrew has been teaching us about. And when you click on this Alert Center, what we will see on the next screen, or what you'll see in Axxess when you click on that Alert Center, is messages that are contained in the Alert Center. And so, Andrew, if we could advance to the next slide, this is what the Alert Center is going to look like. And so you see on each of these lines what equates to a message. And if you think about, there was a comment earlier about equating this to an email address. If you think about each of these as a specific email, you can read across the left the headers on there, the date, who sent this, which patient does this relate to, what is the type of alert that you're getting, the subject of the alert, and then a preview of that. And along the right-hand side, you see the box highlighted there with Quick View. You've got a couple of alternatives there as well. And we'll dig into those a little bit. And I know we're getting a little close on time. I hope that we have time to go back to the poll questions and also perhaps answer any additional questions before we finish up here fairly shortly. But if you were to click that Quick View that we saw on the previous slide, what that will do is take you further into the message that you have selected. And you see on the left, we've highlighted this message that you're looking at now. And what you're seeing on this slide is a little more information about that alert. And if you notice, up on the right, there is an attach to chart button or an attach to chart icon. And if I click on that attach to chart, that's where the magic is really happening, if you will, within the Axxess solution. And so, Andrew, if you will advance us to the next slide, we'll show you a little more detail about what's going to happen when you click that. And if you click that, you're going to see at the bottom, you see that you can download, if there are multiple attachments within this clinical direct message, you can download all of those. If there is just one, you can click on that and download that. And that is going to attach it to that patient's chart. And so you see sort of in the middle of this slide now, below the bold attached documents, you see a patient named Linda Johnson. That alerts you that you are attaching this document or these multiple documents into Linda Johnson's file. So there's no need to fax and print and upload and scan and then go find that in a file somewhere on your laptop. All of that magic now happens behind the scenes, if you will. And so when you activate this interface with SureScripts within the Axxess solution, you are now able to be alerted that there is information about a particular patient. And then with literally just a couple of clicks of the mouse, you can attach that to the patient record, and everyone who has access to that patient record can then access these documents, whether it's an H&P, a history and physical, or it's a medication list, or whatever has been sent to you from the agency that SureScripts is giving us access to through their incredible network. That will be available for your clinicians, for your caregivers, for your organization leadership to be able to see in very easy fashion. And so that is, I believe that may be the last slide, Andrew. There may be, nope, that's it. Okay, if you can back up then, and we'll camp out on that last slide in case there are any questions. What I'd like to do now is pause and see, Molly, if there are additional questions. And if not, perhaps we'll have time to share the results of the poll before we finish up the call today. Are there other questions, Molly?
There is one question, and it is, do you offer a trial period? And I'm assuming that's a question for Axxess, but I'm not sure.
Yeah, I'll pause them. Well, I'll answer that and see if whoever posted that question, if they want to clarify if that's for Axxess or for SureScripts. But when you activate the interface with Axxess, what you are doing is, in essence, joining the SureScripts network. And as I think about the answer to that, I'm not sure that there would be a way to do this on a trial basis, because what you're doing really is receiving live documentation about the patients that are within your organization or who have been admitted or you're looking at to admit for your specific agency. So I'm not sure that a trial basis would even be a possibility. I'm assuming that's a question for Axxess, but I don't know that that would even be a possibility within the SureScripts network. However, if you're on the call and you are an Axxess client, I would encourage you to reach out. You can reach Axxess either through the client experience contact that you have or through your salesperson, especially if you're a fairly new client of Axxess. If you've got a rapport with your salesperson, and they will be able to help educate you and point you in the right direction about either learning more about this interface or about adding it to your suite of solutions within Axxess. Do we have other questions, Molly?
We just got one more in. Would you be able to send us a custom report to check which facilities providers are using SureScripts in our area? I think that might be a question for SureScripts, because I think they have a way to check that on the website.
Yes, that's a great question, but I'll defer to Brian or Andrew to answer that.
Yeah, we do. So I'll answer it from my scope of knowledge, which is that we do have a place on our website, our Network Alliance tab, where you can in fact search out folks that are a part of the Network Alliance. That's obviously a somewhat manual process that is probably more suited to folks who are maybe not as far down the journey as you guys are, obviously, with what us being implemented with Axxess and ready to roll out to clients. But Brian, I'll let you at least give any 2 cents. Is there something that would be more comprehensive or that would be for a current customer or a soon-to-be current customer?
Yeah, so typically we can produce reports, outputs from our directory file if there are certain entities in question that want to validate whether or not they have access to direct secure messaging. So the takeaway that I would say, Tim, is to follow up with the client that posed that question and work with your respective contacts here at SureScripts, and we can help provide clarity on who those organizations are and their direct ability to exchange direct messages. But typically that is something that we can work with you all on to provide some further insight on.
Okay,
perfect. I'll do that. That was the last question in the chat, or the question. So yeah, if we could see the results of that second poll question, that would be great.
Okay, that's interesting. Andrew, I don't know if you have thoughts on this and want to make comments, but 47% say care communication and coordination is the most challenging aspect of managing transitions. And being connected to the SureScripts network helps tremendously being able to solve those two issues.
Yeah, absolutely. Yeah, I think that's really the one of the areas that I know I hit over and over is the reach of the network. Absolutely.
Okay, perfect. Molly, if there are no other questions, I think we can turn it back to you to wrap us up then.
Sounds great. Well, thank you, Andrew, Tim, and Brian, for answering our questions and sharing this great information with us today. For everybody in attendance, if you didn't grab the slides in the handout section of the GoToWebinar, we will be sending it to you along with the recording of this webinar via email. And we will also put it in the Axxess Help Center. So thank you all for joining us today. Thank you to Tim, Andrew, and Brian for joining us as well. We are delighted to have had you, and thank you to everyone who attended. We will continue to deliver on our mission to empower healthcare organizations and professionals with the world's best interoperable technology solutions. Thank you so much. Have a wonderful afternoon.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.